Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is David MacLeod, Chief Information Officer and CISO at Welltok. Welcome, David.
Thank you, Matt, for this morning.
And so it's great to have you on, but I think before we start diving into the real meat of our discussion, could you let everyone know a little bit about who you are and what you do?
Sure. As you said, I am the CIO and CISO for Welltok. We are a company that is focused on helping individuals attain their own personal highest level of health and wellness. We serve our customers, consumers, so those would be members of health plans, employees of employer groups, patients of providers. And what we do is we recognize that at some point, each of us becomes a patient, like when we have an episodic interaction with physicians in hospitals, or what we actually call a sick care system. But all of us are always consumers of healthcare and need to be able to confidently interact with a secure ecosystem of health and wellness choices, services, and tools. A little bit about my background. I am in my fourth decade of providing technology solutions to business needs. In the late 1980s, I began to focus on security and privacy, including physical and information security. I was a member of the team that invented and developed the retina scanner, a device that identifies people by the blood vessel patterns of the retina. And the device was originally intended to be an entrance control device, but we pivoted for biometric control over information. In fact, the first implementations that I directed were for a jail system in South Florida, where we were able to immediately identify repeat offenders rather than waiting for fingerprints to come in, and as a part of an elaborate protection system for the Bureau of Engraving and Printing. After a few years of applying this biometric technology in a variety of scenarios for both government and private agencies, I sort of wandered into the healthcare field. I worked for providers, integrated delivery systems, and payers, including public and private payers, focusing on secure e-commerce, standardization initiatives, and the protection of healthcare information. In fact, I am a fellow of the Healthcare Information Management Systems Society. We're under Presidential Decision Directive 63 and Homeland Security Directive 7, and specifically after 11, I was nominated by Senator Orrin Hatch to the founding board of the Information Sharing and Analysis Center for the public health and healthcare sectors of our nation's critical infrastructure. It's an organization that operates in harmony with and is sponsored and staffed by the U.S. Health and Human Services and Homeland Security departments. Since then, these two sectors have merged into one. ISACs have been established for all of the major and critical components of our national infrastructure, and the healthcare ISAC continues to exist to share information about threats to the healthcare sector, to ensure the capability of first responders, and to plan for the reconstitution of the sector in case of a catastrophic disaster. As a full-time consumer of healthcare and an occasional patient of the sick care system, I want to do my part in ensuring that my care providers have safe, secure, and immediate access to clinically relevant information about me when and where it's needed. I believe this is something we all need and want. And this is the quest I've embarked on, and I'm fortunate that it is also my job here at Welltok, not just my passion.
That is an extremely impressive background. So I'm very interested, kind of picking on it a little bit about the ISAC as you're discussing it. I think it's a pretty unique opportunity to be able to talk to someone who's on one of the initial ones. So are you still involved, or is that have you kind of transitioned off at this point?
No, I'm still an active member. I'm no longer on the board, but I've maintained my active membership in the ISAC because I believe it is critically important for us to share information with other healthcare organizations and to ensure that collectively we sort of raise the bar for all of healthcare in how we protect information and make it available.
So when you're talking about sharing information, is that threat intelligence sharing or something more?
No, it's absolutely threat intelligence. And because there's 17 different ISACs, it's not just sharing amongst healthcare organizations, but we have access to the threats and vulnerabilities and exploits that are occurring across the other 16 components of the nation's infrastructure. And you probably would not be surprised to hear that the most advanced of all the ISACs, the most protected of all of the private sectors, is finance. They've done wonderful things to make sure that our bank accounts and our credit cards and our financial information is protected. And sadly, that information is better protected in many cases than my very personal healthcare information.
It's kind of picking up on that point, which, as you said, I agree with you. I'm not surprised to hear that the financial sector is the most advanced. What would you suggest, or what would you like to see healthcare do to be able to better protect, as you said, our very sensitive personal healthcare information?
I think sometimes people ask the question, do we have an adequate understanding of the threats to healthcare information, as well as what needs to be done? Because you have to understand the threat to know what to do. And I do think we understand what's at risk. There's plenty at risk besides the billions of dollars that are harvested by criminals. And that would include things like improperly disclosed identifiable electronic health information for millions of people. And it can occur in matters of seconds. That's all it takes. The ability to steal health information without having physical access, because it's all computerized. And it can be stolen from locations that might be beyond the reach of U.S. laws. And of course, the breach of an individual's personal healthcare information in a manner that makes it virtually impossible to restore. If someone steals my credit card or my financial information and successfully accesses funds, there are certainly mechanisms in place to make me whole again. But how do you do that with improperly disclosed personal identifying information and, more importantly, personal healthcare information? It's sort of the old adage of how do you put the toothpaste back in the tube? So I think part of the reason that healthcare has become such a target and why we have to take steps immediately, more than what we've been doing, is surprisingly, personal healthcare information is actually more valuable than our typical financial information. I don't know if you're aware of the fact, but a thief can download and steal data, healthcare data, and get $50 on the street for medical information and medical identification numbers, compared to just $1 for a Social Security number. For those receiving the medical ID number and using it, they could defraud healthcare organizations, and the average payout for that is over $20,000, according to the World Privacy Forum. And you compare that to just a $2,000 for the average payout for ID theft or theft of a credit card. I think you're probably aware that there was a clerk in a medical clinic in Florida in a hospital who stole the medical ID of 1,100 patients and sold them on the black market. Those numbers were subsequently used to bill Medicare for $2.8 million in false claims. A hospital in Orlando, Florida, fired 3 employees because they were improperly reviewing emergency department records for almost 2,500 patients. And then they forwarded that information about accident victims to lawyers who were then able to use it to begin personal injury lawsuits. And then finally, the LA Times, just a couple of years ago, reported that the UCLA Medical Center had an employee who improperly viewed a very prominent celebrity's records and sold to the National Enquirer for $4,600. I believe there's a statistic that shows that nearly 3/4 of Americans have heard of or read about healthcare records being stolen. Over half of them say they somewhat trust their healthcare providers to protect their information. Nearly 2/3 believe that existing laws do not adequately protect them and their information. And the current cost per record to a breached healthcare organization is $380 per record. So there's real cost to a healthcare organization, not just in reputational damage and the damage to individuals, but a real cost in recovering from that breach. Last year, there was a study by the Ponemon Institute and IBM that said the total cost to a breached U.S. healthcare organization averaged $7.35 million. A data breach in healthcare costs more than double the cost of a breach in any other sector, particularly, for instance, in the retail sector, and is 15% higher than a breach in the financial sector. I think there's sufficient awareness of the risks and the things we have to address. The real questions are, is there sufficient desire? And is there a clear understanding of what needs to be done?
Yeah, and I think kind of as you're detailing some of the recent examples of breaches, From my perspective a little bit, that helps to, frankly, I don't know too much about other industries, but it seems to highlight some of the issues where you have so many layers of individuals who have access to the information. Arguably, they don't need access to all the information, but that's not always, limited. So is that, I guess the first question is, being able to tap into your knowledge, is that something that's unique to healthcare? And regardless of whether it is or isn't, what are some of the means that could be implemented to help control for those insider issues?
That's a good question. I think part of the challenge in healthcare, especially in Western medicine, if you look at how Western medicine is practiced, it's a very collegial environment, right? I'm sure you've been in a hospital, either as a patient or a visitor, when the concept of grand rounds occurs. And that's where physicians and students and interns go from room to room to room and discuss publicly in front of the patient and oftentimes outside in the hallway information about that particular case, about what that patient is experiencing. And they're used to having a very open and free-flowing environment for information. And as we've introduced electronic technology into that, there is still the desire for that information to be freely available. And in fact, the only secure computer is one that's locked up inside a Faraday cage that has no connection to any network and no people can get to it. It's also the most useless piece of technology. So we have to find that balance between the ability to share information, because we want our healthcare providers to have all the clinically relevant information when needed, but at the same time protecting it, and generally in healthcare, protecting it from external hacking. It's generally not an insider job, although some of those examples I gave you clearly were, but most of the hacks of healthcare systems have been done externally.
Yes, no, I agree. It's I think you've got those two avenues of attack where you have the largest amount of concern, which, as you said, the hacking and those insider examples. So there is a lot of, I think, work to be done, and certainly, as you're suggesting, to improve security. So what steps are you seeing currently being taken that might be laying the groundwork for enhanced security going forward?
One of the mistakes we make in healthcare, not just in healthcare, but in other industries, is we focus very diligently on the notion of prevention, trying to prevent somebody from inappropriately accessing and potentially using or disclosing information. And again, with healthcare, it's very personal information. You can't unwind that once it's been done. The problem is we have focused so much on prevention that we have failed to focus appropriately on detection and response. Sort of by way of analogy, this would be like if I made the decision that I was not going to have locks on my doors and windows or an alarm system because I was so sure that my local police department, as good as they are, that I was so sure that they were going to prevent all crime. And I had no need for any prevention mechanisms of my own and no need for detection mechanisms, something to tell me that something has gone wrong, something to tell me that someone has entered my house when they shouldn't be there. And if you sort of play that out, some of the numbers that we see within healthcare is that it takes as much as 191 days, that's been the average over the last several years, for a healthcare organization to know that they have been compromised. And then another 66 days to contain that breach after they knew about it. That's 3/4 of a year during which somebody has had inappropriate access to healthcare information, largely because the organization didn't know it happened. That was the first 191 days. And then 66 days to decide, well, what do we do about it now that we know about it? Because they didn't have predefined response plans. They didn't know what they would do when someone broke in. They were so focused on the notion that they could stop people from getting in. And that is folly. That is a fallacy to think that we can do that.
Yes, and I hate to say it, but it's you're saying for the security side, it's become so focused on one element that's almost a mirror of the larger discussion about the healthcare industry, where it's been so focused on trying to treat and respond to a condition or an incident once it's occurred, as opposed to the kind of current shift into thinking more comprehensively. But for those of you just joining, I'm talking with David MacLeod from Welltok, and we're talking about security within the healthcare industry. So kind of wanting to shift the conversation just slightly, David, we've been talking a lot about the overall concept and overall construct of security, and I think focusing a lot on security from the industry's perspective. But there's a growing aspect to the healthcare industry, which is to have more consumer or individual facing technology. And kind of as you're describing your current role, you're doing that a lot of interacting with individuals. So what's the state of security for those types of solutions? Because I've, talking with people, there are kind of types of applications and thoughts all over the place. It's, I've talked with some people who sound like they're doing all the right things and thinking about all the right issues and trying to really secure things down, to others who frankly haven't even thought about it, just because they're trying to get something out there. So, with that probably very ill-defined summary of the market, what are your thoughts with this greater shift into the consumer-focused drive for healthcare?
Part of the challenge is that there is such a cacophony of chaos of all the things that are out there, all the tools that are available, either to consumers, to providers of services, et cetera, that purport to address security and privacy concerns. And there's so many of them out there, it's hard to know which ones are effective, which ones are relevant, which ones to rely on. And unfortunately, there are no real standards available. There's no prescription that says, if you have this kind of information, you should do these things to protect it. Or if you have this kind of an incident, you must take these steps. Without that prescription, it becomes a little too ambiguous. But what it does do is make all the more important the formal risk management program that an organization should have in place. So as a consumer, the questions I would be asking, not about the technology necessarily that the service provider utilizes, but what do they do? What is in their DNA as an organization when it comes to security and privacy? Do they require strong passwords? Do they monitor their systems and have alerts set up when suspicious activities occur? Do they have layers of security? Do they have things that protect and mitigate their services if there's any kind of a compromise? Do they have a formal risk management program? Do they actually sit down and regularly review the threats to the information and the technology that they provide or that they are stewards of, and assess those threats and make informed decisions on what they're going to do to protect against those threats? Many people have a misconception about HIPAA and believe, for instance, that HIPAA prescribes what we should do to protect information, consumer information, healthcare information, et cetera. But it doesn't. The biggest requirement in HIPAA is that every healthcare organization have and follow a formal risk management methodology by which they demonstrate and document an understanding of the threats, the potential exploits, the vulnerabilities, what the risk is of information being compromised, and what steps they will take to mitigate that to an acceptable level of residual risk. That is the foundation of HIPAA. It is, in fact, the foundation of any mature, holistic security program. And so as a consumer, and perhaps because of my background, I know that those are the questions to ask, but as a consumer, those are the questions we should all be asking before we entrust somebody with our very personal information.
And I think those are some good questions to be asking. But I guess the one that raises for me to counter on it a little bit is how much power do the consumers have to ask those questions? I think maybe if they have, if they're signing up for it individually, they might be able to do it. But say, for example, it's a tool and being offered through their employer. Obviously, I would hope that the employer is asking those questions, or whoever or if it's through an insurance plan that they're asking those questions. So do you see the ability to kind of do pass-through questions, or what are some of the areas for improvement in terms of making sure that the contracting party is actually doing the vetting that you're suggesting?
So at Welltok, we deal with provider systems, payer systems, and employers. And I will tell you that employers actually tend to ask more questions, and I suspect they're questions that as they turn first internally to decide what kind of platforms and programs they want to offer their employees, I believe they're hearing from their employees what their concerns are about the security and privacy of their information. That finds its way into RFPs. I think we underestimate the power of a consumer's voice. I remember a time when cars didn't have seatbelts. And when enough consumers complained about it, and albeit there was some support, obviously, from the U.S. government, but there's support from the U.S. government in security and privacy regulations too, right? But there was enough of a voice of consumers saying, we want our cars to be safer. We ended up with seatbelts and airbags and a variety of safety mechanisms that continue to evolve, and they're evolving not because somebody has an altruistic view of vehicle safety, it's because the consumers are demanding it. And I think the more that consumers of healthcare in particular, but any consumer, demands those kinds of protections and asks those kinds of questions, the more the industry will be held accountable for addressing them.
I certainly hope that you're right that consumers are able to focus on it. 'Cause, one of my fears is that people have become so accustomed to hearing about breaches or other exposures of data that, a frequent refrain that I'll observe, whether it be online or in other places, is that with all this technology nowadays, privacy is, almost dead, and that you have to assume your information is out there. I personally hope that's not true, but also kind of in the conversation with you, it sounds like there are definitely ways and methods to try and ensure that that is not true, and to be able to protect information, and, as you said, be good stewards of the data that's being entrusted to these tools.
Well, your comment brings up 2 points in my mind. The first is there's a very good website called Information is Beautiful, and they track the world's biggest data breaches. But interestingly enough, they only track those that have greater than 30,000 records being disclosed. We've gotten to a point, to your point, that we accept, and apparently we consider 30,000 improperly disclosed records acceptable because they're not worth tracking. That's a problem. The second point is that, frankly, GDPR is going to force us, even in this country, to rethink our approaches to security and privacy of data. The 25 EU member nations now have some of the strictest data security and privacy laws and the strongest rights to privacy, even culminating with an EU citizen having the right to say, you, whatever organization you are, have to forget you ever knew about me. It's the forget me rule that allows them to declare that their data should be completely obliterated from the data records of an organization. So I think that the U.S. will catch up to that. If you look at, Privacy Shield that preceded this, and, there has been more activity, it seems, in the EU around security and privacy, but we tend to follow that, particularly since many of our organizations are global, or they provide services to people today. For instance, a hospital in New York could easily provide services to an EU citizen if they're here on vacation. And under EU regulations, that hospital is subject to the GDPR. So it's going to drive us to do things. Between things like that and I think a very vocal community of consumers, we will affect the change that we need to see.
So maybe asking you to use a crystal ball a little bit, how quickly do you think the U.S. could move to a system where there's, instead of limited siloed approaches to privacy and security, because I think you mentioned HIPAA, so obviously that's covering healthcare. You mentioned the regulations, but the financial sector has pretty strong privacy and security regulations. But on the whole, we don't have a comprehensive statutory or regulatory scheme to it. So, as I said, what time frame do you think could be realistic in terms of the U.S. moving into a more comprehensive, holistic scheme for privacy and security?
I won't try and predict the implementation timeline, but I think the legislative timeline is going to be in the next 1 to 2 years. If the federal government doesn't act soon, and I think industry is going to demand that they do, just like we did in 1996 when we first caused HIPAA to come into existence, right? We said as a healthcare industry, we can't get to standardization on our own. We need legislation that forces us. Now, of course, that ended up with a lot more than just standardization. But if we don't do this, the state of Colorado just passed a very stringent privacy law. California just passed one. The various states are starting to take it into their own hands. If we can't compel federal legislation that leverages things like the standards out of NIST, which are superb regarding security and privacy. And in fact, interestingly enough, we were just talking to a potential customer in the United Arab Emirates who requires that security meet the standards of the National Institute of Standards and Technology in the United States. So even foreign countries are pointing to some of the standards and technology we have in place. But if we don't get federal legislation to push this and cause us to have a holistic view, we're going to end up with 50 different pieces of legislation, which will be disparate from each other, but every one of which will require more than what we do today. You mentioned HIPAA, and one of the things that people don't recognize is HIPAA really is not best practice, but the floor of compliance. It is the table stakes for any healthcare organization to operate. It is not best practice. It's a lot like saying, I didn't fail that class, but you also didn't get the best grade possible, right? We need to stop accepting minimum requirements like that and have more of a ceiling that we aspire to in the protection of information.
And I think that is extremely well said. And, certainly your point about HIPAA being a floor is, a sentiment that I pass along to my clients all the time. But overall, I think that was a very good call to action to really think about these issues. And believe it or not, we are already out of time. So I want to thank my guest, David MacLeod, for a great conversation today.
Matt, thank you very much. It was my pleasure.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.